So I asked my daughter the other day, and she's in her mid-30s, when does premenopause begin? And she said, I think I'm entering it now. Did you know that premenopause starts when you're like 8, 10, 11, 12 years old? The very first day of your very first period is the beginning of premenopause. Who knew that back then the rest of my life was already being judged on when I was going to enter menopause? I'm only recently learning about perimenopause, and I'm already in menopause. Actually, I'm already postmenopausal, but we're going to talk about each of those stages in this video because, I thought it was me. I thought maybe that just somewhere along the line I had skipped that day in school or missed that chapter. Like, I'm fairly well educated in a medical profession, as a matter of fact, and I had never heard of perimenopause until fairly recently. So premenopause is actually the stage when you first start your period when you're a little kid up until like when your estrogen starts to drop off. And that can happen anywhere from your mid-30s, mid-40s. It varies greatly from individual to individual, but there is a time frame. So in this video, let's talk about those 4 stages of menopause and clear that up right from the beginning to give us a baseline, because yes, there are stages, and yes, nobody seems to really give us that information in our lives. And menopause isn't just as simple as you have a period or you don't have a period. So now you're about to know. Welcome to Women with a Pause. I made this channel because I'm getting ready to be 60 this year, and I'm just learning how much I don't know about my own body, and it shocked me. And I'm finding out that others don't know what they don't know. I want to normalize the conversation, or help to normalize the conversation about menopause, because we need to advocate for ourselves. We need to be our own best provider. We need to be informed. We need to know what's going on and what our options are, because menopause is inevitable, but you really don't have to suffer through it. Like, you don't have to suffer. So let's start with premenopause. Like I said, that starts the day you get your very first period. For me, I was 12 and getting ready to go to school, in the bathroom screaming, "Mom, I'm bleeding." I'm sure other people have had somewhat similarities to at least a part of that story. And at that time, we had sex education in school, so I knew it was going to happen. I guess I really, we had the little take-home kit with a pad in it and picture of your uterus and ovaries and things like that. But so I kind of had an idea, and I wasn't like thinking I was dying. I knew what was going on. I wasn't prepared for it, and I wasn't prepared for my mother to look at me and say, "Welcome to womanhood," like giving me a cake or something. I don't know. So during premenopause, your periods come fairly regularly. This is the time when you are growing up, hitting puberty, and then childbearing and getting ready for the thing that nobody told you about, perimenopause. So premenopause and postmenopause are probably the longest stages of the 4, with probably premenopause being the longest stage, and that's where you're living your fullest sexual reproductive life. And then somewhere along the line, your hormones start to shift and you enter perimenopause, the unofficial Hunger Games of womanhood. This stage, perimenopause, can last 8 to 10 years, and it usually starts in your late 30s, early 40s. For me, it started probably right around the age of 42-ish. And the symptoms, like, I'm finding out some of the things that have bothered me the most in the last 10 or 15 years of my life are probably related to estrogen, and that I probably could have been taking an estrogen replacement and not had to go through a lot of this stuff. I am not a medical professional. Make sure you seek your doctor's advice. These videos are just informative. So I'm going to start with a little bit of a list of some of the symptoms of perimenopause. You can usually, especially if you were somebody who had very regular periods, even if you didn't have very regular periods, you'll notice probably a distinct shift in the regularity or the heaviness. It'll fluctuate. You'll start being irregular. You might miss a period. It might start to come late and you panic at first, like run out and buy every pregnancy test in the store. I may or may not have done that a couple times. Brain fog, hot flashes, inability to sleep, anxiety issues that you never really had anxiety before, or maybe you did and now it's off the charts, and rage, like not just angry, but I'm talking flip the table, energetic anger, rage. And the kicker is, most doctors aren't even trained to recognize these symptoms if you did talk to them about it. Like one medical professional that I have gotten a lot of my information from tells me that of the people that seek help with their physician for what they're going through, not knowing that it's really estrogen related and menopause related, only about 10% of the people actually receive any treatment. They're mostly dismissed as it's in your head, or it's just part of normal aging, you'll have to get through it. Attitudes like that. So only 10% of people will actually receive any kind of treatment. And of that 10%, they will receive things like antidepressants or anti-anxiety medications, all things directed towards mental health and not even directed towards reproductive health and specifically women's health. And that's really scary when you think about how few people are receiving the treatment that they deserve and that they need. And a lot of it is because we just don't know enough to advocate for ourselves and demand the treatment for what we're going through. Again, make sure you share this video with your friends and your other female people, not even just female people, because it helps men to realize what's going on with the women in their lives. And we want to boost this information as much as we can, because there is no reason for us to be going through this alone. And I'll tell you, like I've said in other videos, if men went through half of the stuff we went through, half of the defense budget would be redirected to fixing it. Dr. Mary Claire Haver, who I think is one of the biggest and best voices in menopause and women's health today. I have mosquitoes all around me. She terms it like this: perimenopause is the puberty of midlife, and we deserve better support. Isn't that the truth? So get ready for this. This part blew my mind. Menopause is literally one day. The stage of menopause is one day. And that day is the day that you have gone 12 months without having a period. So 12 months from your last period, that day, when you've gone 1 year without having a period, have your cake, celebrate, because the next day you are postmenopausal. So everything before that date is perimenopausal or premenopausal. Everything after that date is postmenopausal. And here we've been using this blanket term, menopause, you're in menopause, as just meaning like everything after your period stops. But in truth, menopause isn't a phase, it's just a milestone. And why didn't we know this? Because nobody told us. And the system didn't prioritize us. But now we know. And postmenopause lasts the rest of your life. And symptoms can come and go, like bone density loss and vaginal dryness and weight distribution and increased health risks. These are all things that we're going to have to deal with for the rest of our lives. So this channel is not about fear. It's about being informed so that we can work and learn to work with our bodies, not against them. So now you know, these are the 4 stages: premenopause, perimenopause, menopause, and postmenopause. And each one deserves attention, and most of all, it deserves support and conversation. Welcome to Women with a Pause. We're not suffering in silence anymore. So if this cleared anything up for you, or maybe even raised more questions for you, but gave you an ounce of knowledge you didn't have before, share it with somebody. We don't do shame here. We do science and sisterhood. We do pause power, and we're just getting started.